right, welcome to the moderated virtual community forum for the next Rockford Fire Chief. Thank you for joining us. We hope that tonight offers the members of the community an opportunity to ask these four candidates important questions. I am Allison Johnston from IO Solutions, here on behalf of the Rockford Fire and Police Commission. I will be moderating this forum tonight. Before we get started with the questions, there are a few logistics to go over before we hear from the candidates. First, each candidate will have a set amount of time to respond to as many questions as I can ask. They will have approximately 15 minutes. Candidates will be held in a virtual holding room prior to their response time and will not be able to hear the other people's responses. Candidates will talk one at a time, and once their set time is over, they will leave the forum. Then we will hear from the next candidate. There are a total of 4 candidates tonight. We received a large number and wide variety of questions. We are not able to get through all of them tonight, but we have attempted to cover as many of the topic areas as we could. Thank you to everyone in the community who did submit questions. For any community members that are in attendance, please mute yourself and turn off your camera so that there is no background noise. No additional questions from the community may be asked tonight, but I encourage you all to come to the in-person meet and greet next week. More information will be available via the city's website. All right, so let's get started. Our first candidate tonight is Rockford Fire Department's Division Chief of Operations, Michelle Pankow. All right. 1 second while I get all the other candidates in the waiting room, and then we'll get started. All right. So, like I said, first up, we have Rockford Fire Department's Division Chief of Operations, Michelle Pankow. Can you hear me all right? Oops, sorry. Oh, no.
Can you hear me now? Can you hear me? I can't hear you.
Sorry, I apologize. There we go. Can you hear me now?
Can you hear me?
Yes. Yes.
Okay, wonderful. I can hear you as well.
Sorry about that. We were having a bit of difficulty with that. So to get started, could you tell us how you have been preparing for the position as the Fire Chief of the Rockford Fire Department?
Absolutely, and thanks for the opportunity to be here tonight. I've spent the last 28 years on this department preparing for this very moment. I have promoted through all of the ranks. I've filled numerous roles on this department, as well as completed my bachelor's and master's degree. And then just an enormous amount of training, as you can imagine. that would be required for the fire department. And it's all kind of come to this. And I'd like the opportunity to take all of that and share it with the personnel that I've worked with that's become a second family to me. And I'd also like to have the opportunity as the fire chief to give back everything I've learned, everything that I've done all of these years to prepare for this position.
Great, thank you. Next question, what personal qualities should a fire chief possess and what attributes set you apart from the competition?
I do believe that a fire chief has to be forward-thinking and innovative, but also has to have a certain amount of perspective and has to be able to understand what the community needs, understand what personnel need, and how you can combine those two to move those things, to move the department forward and to serve the community. Having said that, what do I think that sets me apart? I just alluded to it a bit. I have filled every role on this department over the past 28 years. And I believe that I have absolutely all of the qualifications to be the next fire chief of the fire department. And I do think that I'm the person to take that innovation and move it even further, and to take our personnel and move them further as well.
All right, next question. With the ever-increasing number of calls for service and the negative impact the increased workload has on employees, what would you do to address burnout within the ranks, particularly among ambulance personnel?
That is a great question, and it is a question that we have been attempting as a department to address. So recognizing that we have roughly 30,000 calls for service a year, and that a large majority of those calls are related to medical needs and therefore the ambulance. How do we leverage the needs of the community with the needs of our personnel? Because obviously, you know, they are the biggest operational asset that we have. They deliver the service. So in an effort to decrease some of that workload, one of the visions I do have for the fire department is to really make an effort to be proactive in reducing the number of calls for service, particularly as it pertains to emergency medical calls and the ambulance. And how we would do that is through a number of initiatives. One, to perhaps prioritize the calls in the 911 center and reroute them to other services and be able to understand what truly are emergencies. In addition to that, focus some of our efforts on EMS or medical prevention. We do currently focus a lot of effort on fire prevention. And so I'd like to see that be focused on EMS prevention as well. We would have to look at different models of service and how we can best use the operational asset, our folks that I spoke about earlier, how we can best use them, but also use them to provide the service, but then also how to make sure that we are taking care of them as well. Because at the end of the day, we do need to make sure that our personnel are at their best so that they can serve this community in the best way.
Thank you. How can the Rockford Fire Department reduce the amount of non-emergency ambulance calls?
As I just spoke about in the previous question, a number of ways to reduce our calls for service, again, to be proactive, would be to take a look at how the calls are coming in, having maybe a nurse partnering with our hospitals and collaborating with some of our local partners to try and reduce those calls and determine when the call comes in, whether or not it is an emergency and whether or not it does need an ambulance, or is there another service that that person would need to be directed to? A number of different services, perhaps. We could direct to maybe a lower acuity type of service, or even in some cases, mental health. That is huge, that we do see that a lot in our calls for service. So trying to get those folks where they need to go in the right service. And by doing that, that does help reduce the calls for service and make a much more efficient use of our ambulance and the service we provide to the community.
Thank you. Next question. Several studies have shown a need for additional ambulances, fire suppression companies, stations, and as a result, staffing. How would you approach this issue?
Well, there are 4 parts to that question, and the biggest piece is having to leverage all of those pieces and come up with what is the best plan to address the needs of the stakeholders. So with regard to ambulances, first and foremost, I think I talked a little bit about trying to reduce that call load. So we are making more efficient use of our ambulances as it pertains to emergency service. And the great thing about the fire department, if you live in the city of Rockford, you get a fire truck and an ambulance when you call for a medical call. So what that means is you are getting advanced life support care with that fire truck. Every fire truck that gets on scene does provide, or does have a paramedic and provides a higher level of care until the ambulance gets there. And then they work together to give that patient the best care that they can. In addition to the medical calls, keep in mind, we do respond to a structure fire once every roughly 35 to 36 hours. The Rockford Fire Department responds to an actual structure fire. So having fire trucks and having them positioned and our resources where they need to be to address some of those performance gaps are in fact extremely important. So trying to leverage all of those together and get to the part that really makes this department tick, and that's the people, and what do we do with our staffing. The study that you mentioned, that's what we call our community risk reduction study. It's the standards of cover. I did lead the team and have led the team for the last decade in preparing that study, and am very familiar with the needs and the performance gaps. So recommendations do show that we need to position our resources in a more efficient manner. While we provide a great service already, we certainly can do better. And that is exactly what I would like to do as the next fire chief of the Rockford Fire Department.
Thank you. Next question. An influx of monies is set to reach the city of Rockford from the American Rescue Plan and with the opening of the Hard Rock Casino. How should those funds be utilized that are designed for the fire department?
Well, every fire chief would tell you we need more fire stations. So having said that, every fire chief would also recognize that we do have to work within the confines of what our community needs. And so with the influx of those funds and additional funding also from the ground emergency medical transport reimbursement program, taking those funds and the ones you mentioned earlier and looking at our study that we just talked about, the community risk reduction study, and see just how we can use that money to more effectively serve the community. Is it to relocate resources? Is it to put money towards reducing the call volume like I spoke about earlier? I would argue, yes, that money should be spent and should be put towards reducing the call volume for our EMS calls. It should also be put towards reallocating our resources and making sure that we are covering all of our areas of the city the best that we can.
Thank you. Next question. Last recruiting efforts resulted in less than 200 applicants when years past 500 to 1,000 applicants applied. How do we overcome this challenge while attracting diverse applicants?
Well, that's actually something that is extremely, extremely near and dear to my heart. First of all, to address the recruitment efforts for the last cycle of testing. One thing we were very plagued with, as most of the country was plagued with, and that was our response to the COVID-19 pandemic. So that did hamper our recruitment efforts. But having said that, our department has made some movement toward reflecting our community, which is what I think that this department should do. We should continue to move towards reflecting the demographics of our community. And we've moved a little bit, but there is a lot of room for us to improve, for sure. And so I do feel that recruitment efforts should be focused at collaboration, partnerships. We cannot do this in a vacuum. We do need to reach out to our local partners, the Rockford Park District, the YMCA, the Boys and Girls Club, the local schools, in an effort to expose today's youth to the fire service and to help bring the next generation into our department. This is a great department, and I think that we can move this forward. We absolutely can move this forward, but I don't know that we can do it alone. We need to reach out and build relationships, build on current relationships, and look to our community partners to help us move the needle towards representing our community within the department.
Thank you. Next question, how would you increase morale and cultivate leaders in the Rockford Fire Department?
Well, I would argue that we do cultivate leaders. I have to say, I am so extremely proud to be part of the Rockford Fire Department. I've been here, like I had said earlier, for 28 years. I've grown up on this department, and I look to my peers and my teammates and my colleagues, and I'm so impressed every day at the work they do and how each of them grows. Having said that, how would we share that back? How would we grow that? Currently, we do grow that. We have programs and projects where we seek input from all of our personnel, all different ranks. Our accreditation program, we have every rank represented in that work group, and everything from folks that are just off probation all the way up to, chief officers that are part of that program, which touches every bit of this department, and it engages our personnel. I'm extremely proud of that and how much they've all grown. We would continue to collaborate with our external partners to help develop our personnel and move them forward in the department, within the department, support training, support additional education to grow them and get them to the positions, that we have available. And in addition to that, the piece that I think is most important is that mentorship and that connection that you have with people, and being honest about when you've made a mistake, and being honest about how you can work to not make that mistake again and share it so that people can learn and people can grow. So that is how I would work to grow our people and help with our morale on the fire department, because if you've got strong leaders, well, where you have strong leaders, you've got good morale.
Great, thank you. That is all the time we have for your questions tonight. We appreciate you taking time to be here with us, and we're going to move on to the next candidate now. Thank you.
Thank you. Thank you, Allison. Have a good night.
You too. All right. Okay. Next, we will be moving on to the Rockford Fire Department's Division Chief of Administration, Matthew Knott. Division Chief Knott, are you with us?
I am. How are you?
Oh, you're good. Thank you. All right. So your first question is, how have you been preparing for the position as the fire chief of the Rockford Fire Department?
Thank you for the opportunity to be here today. I'm very humbled and honored to be here. I think our preparation for the job of fire chief started on day one, learning what our department's about, understanding our culture, understanding our people and how best we could serve them. I've been very involved in education. I have a bachelor's degree and a master's degree from NIU, but I think the one thing that I'm most proud of is being a City of Rockford resident. That passion and the drive and the motivation to make our community better is very strong with me, and I really look forward to serving as the next fire chief. As part of that, I've been invested in the City of Rockford. Like I said, I've worked closely with Chief Berkston and worked closely over the last 12 years in various divisions here at the Rockford Fire Department and served in various roles and really am ready to go on day one. Work closely with our budget. I'm responsible for managing our budget of over $55 million a year. I'm responsible for all of our outreach efforts through our fire prevention division and really responsible for a lot of our collaborative efforts, which really make our organization stronger and put me in a position to be ready to start with this job on absolute day one. So very passionate about our department, very passionate about this position and really look forward to being able to lead and serve well into the future.
Thank you. Your next question is, what personal qualities should a fire chief possess and what attributes set you apart from the competition?
So I think the fire chief is best served by a couple skills. One is being able to listen. And I think that's the most important part. When we look at our community and all the population that we serve, I think the collaborative efforts that we've done historically is what truly set us apart. And I've been involved in those things. We've done some extraordinary things, but we couldn't do them ourselves. The men and women of the Rockford Fire Department are absolutely fantastic and huge assets to this community and something we're all very proud of. But working with them plus our cooperative community partners is really what set us apart and really let us achieve many, many things. Some of the innovations we see with healthcare institutions in town, with Alignment Rockford, with the Rockford Public School Districts, those are the things that really helped us to move forward and move our organization forward. And I've been involved in all of those things. As far as our other candidates, they're fantastic, and every single one of them is a great friend of mine, and I've known them all for over 20 years each. But what I bring to the table that's a little bit unique is, again, working in our fire administration for over 12 years and understanding the true intricacies of what makes a department work, working with our other department heads, managing a multi-million-dollar budget, and being responsible for all aspects of this organization, including serving as acting chief in the chief's absence multiple times, really provides me the tools and the resources and the equipment, along with my education, to be successful. And like I said, really look forward to serving as the next fire chief.
Thank you. With the ever-increasing number of calls for service and the negative impact the increased workload has on employees, what would you do to address burnout within the ranks, particularly among ambulance personnel?
Sure. And that's a real problem. I mean, it really is. And that's something we see nationwide. One of the things that I also do is I lead accreditation teams. And these teams go out, make recommendations to other organizations. And this is something that we don't see just in Rockford, but see all over the country and into Canada too. When we look at our organization specifically, we see that well over 78%, almost 80% of our call volume is EMS related. And we can't continue doing things exactly the same way. When we look at some different models in some different organizations, there's ways we could triage calls. We work closely, our 911 center, the men and women of our telecommunicators work here in this building. We work collaboratively with them. They're under the fire department's jurisdiction. And I think we have real potential to do some innovative things. And when you look at these innovations, it's going to actually do a couple of things. One is it's going to reduce that call volume that we see, but it's also going to be providing more of the right care to the people that are involved and that end user. So our citizens, we've addressed what we consider people that would call repeatedly. So people that call perhaps 10 times a year or more, we've been able to address those issues. And that is our mobile integrated healthcare program. We've seen some great strides in that with that innovative program, but we need to expand it a little bit further and look at things like triaging of calls, assigning the right resources to those incidents, and perhaps low acuity responses where we're able to send more appropriate resources that actually provides a better level of care and gets the people that are calling and requesting services to more appropriate resources that perhaps right now our one size fits all model isn't very effective, where we transport people from their home to the hospital, but perhaps we could use clinics or some of our allied partners in the city to provide more appropriate resources to them. So we've seen great successes in other programs, and we're also aware of other communities that have done similar models and really some innovative practices, and really look forward to implementing these in the future.
Thank you. Next question, how can the Rockford Fire Department reduce the amount of non-emergency ambulance calls?
All right. And like I said, that's something that we have seen. We have well over 22,000 EMS calls. And we look at the closest city in Illinois, and they're about 10,000 calls less. We've identified individuals that call frequently. Like I said, we have a robust program to deal with them with our mobile integrated healthcare program. That's the largest piece of that is in collaboration with Swedish American Hospital, where we're actually making home visits. One of the things that I've been working on recently is a way to expand that program specifically. And that's with Molina Healthcare and Swedish American Hospital, where we've actually developed a vehicle that will allow our mobile integrated healthcare paramedic and a nurse from Swedish American Hospital to make those house calls a little bit more effectively and provide a little bit more appropriate care to an individual at their home. So we've looked at different models. We've addressed those people that the people that are citizens that have called more than once, probably along the 10 or more calls a year. But where we really see the issue now is individuals that call perhaps once or twice their whole life. We have robust GIS capabilities, and when we look at our GIS system, using data to map out where these calls are and identify specific areas or threats and those specific opportunities that we can address and provide more appropriate resources. We've done collaborative efforts with Winnebago County Health Department, with Swedish American Hospital, and we've discussed concepts with some of the large healthcare institutions throughout the state about taking a mobile clinic or perhaps some alternative vehicle to be able to provide care in certain geographical areas and address the specific needs. We have the data that shows us, and we're really looking forward to implementing a program that allows us to take actually that right care at the right time at the right price to the right people.
Thank you. Several studies have shown a need for additional ambulances, fire suppression companies, stations, and as a result, staffing. How would you approach this issue? Sure.
And that is correct. We've looked at, one of the things that our accreditation model does. Rockford is an accredited fire department, and our ambulance service is also accredited through CAS. These are very important organizations and really set those national best practices for us. As we look at our organization specifically, we have identified a need internally too for just the items that you've spoken of. When we look at our organization through our standard of cover, and that's one of the documents that's put out through our accreditation process, and our strategic plan, which takes over 75 to 80 individual stakeholders from the community and gets them involved in our planning process, we identified some specific gaps that we have. Being responsible for our budget and being responsible to work with other department heads in the positions that I work in, I understand that the limited dollars that we do have has to be spread fairly thin at times. And, certainly my job as fire chief would be to advocate for additional resources, and be cognizant of the city and that we work for and all the specific demands and needs. Because again, as our demands and needs increase, so do law enforcement and so do public works and all of our other partners that we work with. And again, my job is to work collaboratively to find the best solutions, to explain our data and our specific needs, and then work to provide appropriate resources for our personnel.
Thank you. Next question. An influx of monies is set to reach the city of Rockford from the American Rescue Plan and with the opening of the Hard Rock Casino. How should those funds be utilized that are designated for the fire department? Sure.
We first received information that these funds were coming to the city of Rockford, and we were very excited about it. When we look at them and specifically some capital improvement projects, we've already started to discuss our unique needs. And again, like I talked about with our standard of cover, we've identified some specific gaps. We've identified some specific stations. And again, the specific need for some major upgrades to our facilities. This is something we're well aware of. We're working closely with our city, other departments, and we've already met on this actually to discuss this. Again, my responsibility as far as our budget goes is to develop our capital plan. We've done this in conjunction with our public works department. We've identified specific needs and then also work to identify what our goals are. And if we have certain funding available, to make sure that we're allocating that appropriately and look to perhaps definitely make some major renovations to many of our facilities and perhaps look at other improvements that we can do. But again, we're going to balance what we're doing in conjunction with one is the guidance of these funds, which we haven't really received all of the guidance yet. So and that's from the federal government. There's still some questions as far as funding eligibility. So we continue to work through that. We've been staying on top of it from day one since the funds were first announced and the programs were announced. And we'll continue to work with our other city departments to make sure that our needs are addressed. And we'll also make sure we're weighing upon the entire needs of our community.
Thank you. Last recruiting efforts resulted in less than 200 applicants when years past 500 to 1,000 applicants applied. How do we overcome this challenge while attracting diverse applicants? Sure.
So kind of taking the question backwards and looking at the diversity and our inclusion it was really a specific goal of ours. A few years ago, we established a recruiter position, and this is something that we've done on a part-time basis, basically. But now we have a full-time recruiter, and we've had one in position for a few years now. And this position and what we've looked at with that is how can we improve our recruiting efforts, and specifically to increase City of Rockford residents, diverse populations, and also populations that are able and prepared to be Rockford firefighters. Our ultimate goal is to create that sense of belonging. So as individuals apply to us, they feel engaged and involved in our organization and are big parts of our community. So that's the important part. We've also looked at how we can improve what we're doing. And so we've reached back into grade school programs. We've started there. We've started introducing careers of fire and EMS, providing some tools and resources so that individuals can understand what it's about and be prepared as it goes. As we get into our high school programs through some of the innovative project, the collaboration that I'm involved with Alignment Rockford, we're developing a career pathway, which is a partnership between Rockford Fire Department, Rock Valley College, Alignment Rockford, and Rockford Public Schools. Fantastic efforts, and something I'm really proud of is that we're gonna put together a recruit class that is career ready. And these are individuals that are going through high school, perhaps involved in our Explorer Post, which is again a high school program. So we're developing candidates for us in the future that will really serve our organization well. As we look at our recruiting efforts, our numbers are down. As I go drive anywhere in town, I also see that there's a big demand for individuals everywhere. And I think that in doing research on this too, this is this is a national issue. We see populations are less likely to apply for public safety jobs over the last couple of years. And we see a huge demand for hiring of positions. I would contend that our candidates that we have applied are ready to go. We've seen some pretty successful candidates and historically we've had a lot of applicants, but we've seen dropouts at certain points, maybe perhaps not showing up for written tests or not being able to or not be able to pass a physical ability test. We've invested a lot in our new candidates and we made sure that they had the tools to be successful. So we've seen less applicants, but we've seen percentage-wise more of those applicants being ready to go before our board for those last interviews. And those are through some partnerships with Mercy Health and top performers to be able to prepare them for the candidate physical ability test, through some of the workshops we held to make sure our candidates are prepared for the written test. And I'm very proud of the efforts that we've done, and I really look forward to this next recruit class.
All right, thank you. That is all the time we have for your questions tonight. I appreciate you taking the time to speak with us tonight, and we wish you the best.
Great. Well, thank you very much. Thanks for the questions, and thanks to everybody in the community that submitted questions, and look forward to meeting everybody on the next step. So thank you.
Thank you. All right. Next, we will hear from Rockford Fire Department Captain Kyle Hill. Hi, Captain Hill. Can you hear me all right?
Yes, I can.
All right. Your first question tonight, how have you been preparing for the position as the Fire Chief of the Rockford Fire Department?
First of all, thank you for the opportunity to be here and share my vision and goals for the fire department. For the last 22 years, I've been a firefighter on a fire company and working with the finest men and women of the fire service in the whole country. And through that time, I've always been preparing myself for the next promotion. I've been on the fire company for 22 years, and I have spent at least half of that time as a company officer. During that time, I've made it a point to become a student of firefighting and also of leadership. I went through Rock Valley College's program. I went through Southern Illinois. I got my bachelor's degree in public safety management. I've had numerous opportunities to travel the country and learn from some of the finest people in the fire service and really understand what it meant to be able to manage emergencies. A few years ago, I had an opportunity to work with the Chamber of Commerce and took part in their Rockford Leadership Alliance program, where I was able to work with other community leaders and people also trying to learn how to be more effective leaders in their community. And so through all those experiences, it's really prepared me to take the next step in my career and apply for this job. I've also had an opportunity to attend classes to become an accredited Illinois Professional Emergency Manager. And with that, there was a lot of leadership classes that were involved in that, as well as different ways of handling large-scale emergencies and responding to that, and really being able to keep our community moving in the right direction in times of emergencies. So all those things put together have really helped me prepare myself for the next promotion in my career.
Thank you. What personal qualities should a fire chief possess, and what attributes set you apart from the competition?
So a fire chief, above and beyond all, should have integrity. Everyone should be able to look at that fire chief and know that they're going to do what they say they're going to do. And they should be able, and with that integrity, you have to have, your employees have to have trust in what you say that you're going to do. and they need to be able to trust that you have their best interest at heart. Along with the employees, the community has to trust you as well. So those things are probably some of the most important things that a fire chief can have, along with being a collaborator and working with other community departments, other city departments to accomplish a common goal. I mean, the fire department is just one entity of a large organization, and we all have to work together to accomplish those goals. I do have that integrity. I believe I have the trust of the men and women of the Rockford Fire Department. I've worked with them. I've been in the trenches with them, and I know each and every one of them, at least on some level. I've taught in the academy, so I've seen just about every recruit that's come through our academy, and I really care about what is going to affect them in their careers, because if they can't operate effectively, then they can't provide the best service that our citizens have come to deserve. So the other candidates, they're great people. They're great friends of mine. I've known them all my career, and I know that they are their heart is in the right place as well. What I bring to the table is experience out in the company level. I've been out there for 22 years. I know what our personnel are going through on a daily basis. And I also know what's going on in the community because I'm out there every day. And we're serving our community, and I've worked on all parts, different parts of our community, north, south, east, and west. And I've actually seen what it is that our community goes through on a daily basis, and I see those needs. And so that translates as a fire chief. Now I have a good understanding of what's going on out in the field. And I think that's very important. I've made many partners throughout our community through training and visiting businesses and just in general responding to emergencies. I've made a lot of partnerships, and I always tell people when I meet them that we're building a relationship so that the next time we see each other, we know what each one is capable of, and we know what we bring to the table so that we can work together to make our community a safer place.
Thank you. Next question. With the ever-increasing number of calls for service and the negative impact the increased workload has on employees, what would you do to address burnout within the ranks, particularly among ambulance personnel?
Wow, this is a real issue that our personnel are experiencing. The health and wellness of our firefighters has to be first and foremost when we talk about this subject. They are the most important resource that we have on this fire department. And we have to address the level of work that they're expected to do. I know that I have an ambulance at my fire station, so I see that happening each and every day. We have to be a little bit innovative and start to look outside the box and how we can help reduce that workload on those people. Some of our paramedics are working on the ambulance for 10, 11, 12 years plus, and it does weigh on them. They take that burden home with them, and we need to address that. I do have a few ideas that we can explore, and hopefully I can work in conjunction and collaboration with our local labor force, our union, to make sure that we're doing the right thing for our personnel and that we're doing enough for our personnel. There's some possibilities that we might be able to reduce the number of hours that they are actually working on those ambulances. Again, that has to do with how we can bargain that in our collective bargaining agreement, but there's certainly some room to maneuver. Another way is to reduce the call volume. The fire department responds to, we'll probably do 30,000 runs this year, and nearly 80% of those are EMS. So through some partnerships with our local hospitals, we've established a mobile integrated health program, and that helps us to reduce the number of repeat users that we get on our daily calls. If we can do that, we're going to actually decrease the number of calls that our paramedics have to go on. Right now, we've seen some relief on that, but it's still not enough. We have to do more. There may be an opportunity where we can start to target the types of calls that we're getting. If they're basic life support calls that could be handled at home, there's a possibility that with some collaboration with our hospitals, that we can get healthcare professionals into the house to head those calls off before they actually ever happen. So there is some room for some innovations. I know that the fire department has had good cooperation from Swedish American Hospital, as well as some of our local insurance companies, that they also see the benefit in reducing the amount of time that people spend at the emergency room and admissions to the hospital. So if we can do that, we're going to reduce the number of calls that our paramedics have to go on. And then in turn, that's going to reduce their workload and make our community a little bit safer. And hopefully we can have a healthier community to go along with that.
Thank you. Several studies have shown a need for additional ambulances, fire suppression companies, stations, and as a result, staffing. How would you approach this issue?
Well, those studies are our own. We've looked at that and we've identified areas where we're deficient. And there can be big gaps in our response times, especially in the Far East area where our call volume has started to increase. And that number of calls is not going to decrease in the future. It's only going to increase, especially with a casino going in out there on the Far East side, and other infrastructure that's starting to build up with different apartments and things like that. So we're going to have to address that at some point. Right now, we have a limited number of personnel, and how we deploy those personnel is going to help us make sure that we're giving the best coverage and the most effective coverage on a daily basis. Would I like to have more ambulances, more fire trucks? Absolutely. At the current time, our tax base doesn't support that. And I know that the city is working hard to get more business and more revenue coming into our city. And as that starts to happen, then we can start to look at where we can add resources to our current infrastructure. We do have some fire stations that are in bad need of attention. So maybe we can take a look at that and see if maybe not repairing those fire stations is the answer, but maybe relocating those fire stations so that they can provide better coverage. We've already done that once down on the south side of Rockford, Fire Station 7. We relocated that and helped close the gap on some of our response times, which is a direct benefit to our public. We do have some other opportunities for that, and I would definitely look to explore those opportunities, see what the outcomes would be. We can model that and then move forward with presenting that to the city council and to our city leaders so that they can see the numbers that we're seeing, and we can hopefully make a difference and start to close the gap on some of those fire companies that are reach their limit on how many calls that they can go on.
Thank you. Next question. An influx of monies is set to reach the city of Rockford from the American Rescue Plan and with the opening of the Hard Rock Casino. How should those funds be utilized that are designated for the fire department?
Well, first of all, I can remember not that long ago, maybe 10 years ago, when our fire trucks were in very poor repair. We were putting Band-Aids on things and limping along. Chief Bergston has done an outstanding job of bringing our fire companies and our fire trucks, our capital, up to speed with where it should be. We're going to have to continue that. Our budget right now is doing an adequate job, but we can't let off the gas. We have to continue to stay ahead of that program so that we can continue to use those fire trucks to the best of their ability. We also can use some of that money to look at these programs where we're trying to prevent people from having to go to the hospital. If we can work in partnerships with our hospitals and our other partners, we can use some of that money maybe to put personnel in strategic places where they're able to get out and actually make a difference in the community and help some people and educate some people on staying home and staying healthier so that they don't have to go to the hospital. That would go a long ways. With the addition of the Hard Rock Casino, that's going to add to the workload for our resources. So I would have to look to beef up some of that area around the Hard Rock Cafe casino in order to make sure that we can provide the best service possible out there on the far east side, as well as the far west side. We don't want to forget about the rest of the city, which needs just as much service as any other portion of the city. So we want to make sure that we're taking care of that. So the money that's coming in is relief money. COVID took a toll on our resources, and it took a toll on our personnel too. We can't forget that we had an influx of calls for service, and that really did affect our personnel. So we can use some of that relief money to bring us back up to speed and get our equipment, or keep our equipment where it's at, and keep moving forward with the latest innovations in fire service equipment.
All right. Thank you, Captain. That's the last question we have for you tonight. We wish you the best and appreciate you taking your time to talk with us.
Very good. Thank you for your time.
Thank you. All right. Our final candidate tonight is Rockford Fire Department Captain Trent Bress. Hello, Captain. Can you hear me all right?
Yes, I can hear you good. Can you hear me okay?
Yes, great. All right, your first question tonight. How have you been preparing for the position as the Fire Chief of the Rockford Fire Department?
How have I been preparing for the position of Fire Chief for the Rockford Fire Department? I've been on the Rockford Fire Department for over 20 years. And with that, I've been preparing myself since I started within the service. And with that, I've been taking classes. I've attended the National Fire Academy in Maryland, and I've been working on my Executive Fire Officer certification. I've also obtained my master's in public health through the University of Illinois at Springfield, with an emphasis in geographical information systems. So with that, I've taken additional classes, and I've also worked on bettering myself as a leader within the organization through involvement with outside agencies and volunteering throughout the community. Has helped me to be committed with the organization as a whole and within the community. Plus, living in the community, I have the chance to be involved with it and also committed with it, which is important, I think, as a leader within the fire service organization.
Thank you. Next question, what personal qualities should a fire chief possess, and what attributes set you apart from the competition?
Yeah, what attributes would set me apart from others with this position? The first thing I would say is I'm a very genuine person. What you see is kind of what you get. And with that, I think a couple of the qualities that would set me apart from the other candidates would be I'm very approachable. In that, I'm a warm person, which I'm willing to meet with others. I don't judge people, and I actually support people. So that's one quality I think is very unique to myself. And with that, I also, through the fire service with my members, I do that. And even I teach out in the community. And through that, I've been able to just make good relationships with those out in the community. Another attribute that I feel sets me kind of apart from others is I'm a good listener. I take the time to listen to individuals within the fire service and outside in the community and kind of learn to understand kind of the needs that they have, so that if there's in a situation where I need to help them out or give them some guidance, I fully understand where they're coming from. And the last thing I would say that sets me apart from others is I'm a good problem solver. One of my strengths is I can take an area of concern or needs, especially within the community, and make something happen. For instance, one of the couple programs I've been involved with as EMS coordinator was to design a program known through the fire department, known as a mobile integrated healthcare program, in which we sent community paramedics out into the community to work with the underserved within the city of Rockford to provide them some support and some social needs that they needed to help them overcome some of their social determinants of health concerns, such as housing needs, food needs, and even medical needs with that. So that's one. These are three strengths I feel as attributes that set me apart from the other candidates, and I think would be great qualities that the fire chief should possess within the city of Rockford.
Thank you. With the ever-increasing number of calls for service and the negative impact the increased workload has on employees, what would you do to address burnout within the ranks, particularly among ambulance personnel?
So what would I do with the increasing calls, and how would I address the burnout? That's a good question. One of the things, the fire department provides a high level of care within the community. Our ambulance crews do a terrific job with the professionalism that they deliver. But surprisingly, Rockford is a busy fire department. Outside the city of Chicago, the community might not know is that the Rockford is actually the second busiest fire department outside of Chicago. We respond to last year we responded to over 29,000 calls. And this year alone, we're projected to respond to over 30,000 calls, with 80% of those calls being emergency medical calls that impact our ambulance service crews. So with that, there is our members do go on a lot of calls, and there is a concern that they have as far as burnout with the increasing calls that they go on. One of the things I'm doing is actually I've partnered with a member from the University of Illinois Medical School, and she's going to be doing a research project on actually looking at pre-hospital burnout and looking at different variables that are related to why our personnel are maybe having that feeling of burning out. Besides the increasing calls, sometimes it's just the constant working with the individuals on calls where we don't feel like we're making a difference. And so that's one of the things I hope that this research project will do, is actually help our members to see what can we do to identify it and what strategies we can use to kind of help them with the burnout factor that they're feeling.
Thank you. How can the Rockford Fire Department reduce the amount of non-emergency ambulance calls?
So what can the Rockford Fire Department do to reduce the number of non-emergency ambulance calls? The Rockford Fire Department, again, we do a great job with the services we deliver. One of the projects I was involved with a couple of years ago as EMS coordinator was to develop our mobile integrated healthcare program. This was a program that was near and dear to me. The program was designed to help the underserved within our community. And with that program, I saw an actual reduction in the number of individuals that were transported to the emergency department. And with that, we also saw a cost savings to the hospital system. This program was worked in conjunction with the Swedish American Hospital. So again, with developing programs, it helps to have collaboration with other organizations to make things successful. And with that, if we can increase our mobile integrated healthcare program, I feel we can actually help reduce some of these non-emergency calls. So with that, so expanding our mobile integrated healthcare program would be definitely a priority of mine. And another program I would like to expand upon is our mental health program. I saw recently in the paper, the Rockford Police Department received a grant of about $2 million to increase their response to mental health calls using a social worker along with the police officers. And one of the things I'd love to see is our a fire department member involved with that response team. Because we do go on calls where individuals have a mental health issue, but unfortunately, sometimes they don't get taken to the appropriate facility to get that help that they need. So that is one area I would love to see that our department expand upon and utilize that service in collaboration with the police department, with the social workers. I think would be a great tool with that. And another area I think that we can expand upon to help reduce the number of non-emergency calls is to actually get out there and do some health education. With that, we need to get out, just like we do with our Fire Prevention Bureau and talking about fire preventions and reducing the number of fire calls. We need to get out in the community and actually speak to our community members about what is healthy living like, what can we do to help people navigate using doctors' offices versus the emergency departments. So if we can expand upon it, that would be one area I think would help reduce our overall calls, for non-emergency type calls. And with that, though, we need to partner with the Rockford Health Council, who has some goals and objectives with their ideas, and also with the health department, who also provides some health education training. So if we can work with these two organizations, I think that'd be a great success moving our department forward.
Thank you. Next question. Several studies have shown a need for additional ambulances, fire suppression companies, stations, and as a result, staffing. How would you approach this issue?
So studies have shown a need for additional ambulances, stations, and how would I approach that? So as the leader of the fire department, I think the first thing would be to do is to evaluate our city and evaluate where our increasing calls have been occurring. And one of the things we could use with this is some technology known as geographical information data. And one of my things when I worked on my master's of public health was to get a certificate in the GIS arena. And what is important with this is that we can actually see some trends and some patterns of where our calls are occurring. And with that, we might need to look at moving some of our assets and allocation of our resources to different parts of the community. Because we might notice that the city of Rockford has changed. We might see a trend in calls going from the west side of town to maybe more the east side of town. And this has actually been identified through the accreditation committee, where they found that the east side of town has had high increase in calls, which has increased the number of service gaps within that area. So for a community, what is the concern about that? Is if our resources are being tied up on one call and there's another call with it, then it starts pulling from other spots, which delays our response times. So as fire chief, one of the things I think we need to do is to develop a plan that addresses the changing of the city as far as the where calls are occurring at. And our stations were built many years ago, but I think that our community is actually kind of changing as far as the how it's expanding out east and different directions. And with that, I think it's very important to have a plan, in which I do, that actually addresses both EMS I have for and to generate of that would not cost the community any extra tax dollars with this plan to develop some increase in revenues. So with that, that would definitely be a priority of mine to make sure we have adequate staffing and resources available for within the community as a whole.
Thank you. Next question. An influx of monies is set to reach the city of Rockford from the American Rescue Plan and with the opening of the Hard Rock Casino. How should these funds be utilized that are designated for the fire department?
So how would funds from the American Rescue Plan benefit the fire department and be used? So the fire department, we do a great job with what we have right now, but it would be great if we can use some of those funds to help in areas that we need some improvements. And one area I would look at doing is looking at maybe improving our stations. Our stations are old. We talk about, we want to increase our diversity within the fire department, but our stations are such where they were designed kind of after like the Korean War and some other wars, where they're kind of designed as like army barracks in a sense. So we need to improve our stations to make them more livable and more privacy with it, just so we can help improve the diversity amongst our members. So with that, I would like to, again, using some data and kind of start to look at the footprint of our department to see, do we need to start allocating and moving some of our resources to different parts of the community? And with that, we can work together with the city leaders to use these funds to build nice new stations. Plus, it's definitely a reflection on the community. Our buildings that we live in and have in the community, we want to grow within the city and make our community look more presentable. And the fire stations would be a perfect asset to do this. Along with that, my goal too would be, as we build new stations, is to keep stations as neighborhood stations, because I feel it's very important to keep the stations in the neighborhoods so that the community feels more open to come visit and just understand what we do day in and day out as an organization.
Okay, thank you. Last recruiting efforts resulted in less than 200 applicants when years past 500 to 1,000 applicants applied. How do we overcome this challenge while attracting diverse applicants?
Yeah, diversity, equity, and inclusion is a very important topic in any organization. The Rockford Fire Department is no different. It's something that we need to embrace and we need to grow within our organization. At Rockford, we do have diversity within our organization. We have women on the job. We also have people from other ethnicities on the department. But the Rockford Fire Department diversity numbers are below the national average. So we need to work on increasing that because it's a reflection of who lives in our community. And Rockford has a very diverse community with that. So we have a great recruiter who is doing some great strategies on trying to increase the number of applicants that are taking the test. And as the leader of the department, that would be something I would work with him on, trying to look at why are we having such a small number of people taking applications out, and why only a few people are taking actually applying and fulfilling it. Is it how we're marketing it? And look at different strategies to improve it. But Rockford's not alone in this process. When I was out at the National Fire Academy, this was a topic we talked about as a group. And fire departments out west in Oregon and Washington area, down south in Louisiana, to the Midwest in Kansas, and to the east, everybody is feeling this effect of trying to hire and improve the diversity within their departments. So the hard part is sometimes getting applicants to apply and actually take the test. And that's something we need to work on as far as improving within the city of Rockford.
All right, thank you. That is all the time we have for questions for tonight. I appreciate you taking the time out of your day, and thank you again for joining us.
Yep, thank you for having me, and thank you for the community for listening.
All right. Thank you to everyone for joining us tonight. That is all the time we have for tonight, and we want to thank you all again for joining us and hope you all have a great night. Thank you.
Thank you.